Good morning. This is Dr. Hindwara. I'm here today with Dr. Alex Mangarian. So today we are going to talk about bipolar disorder. Last time we talked about how stress is involved in the precipitation of bipolar disorder. Today we are going to talk about an interesting topic, especially what happens in patients with bipolar disorder, because we do talk about uh, classic manic symptoms, right? And one of the manic symptoms that we always ask patient is about impulsivity, right? So impulsivity could be sexual impulsivity or the spending impulsivity that you see in patients with bipolar disorder. Now, this particular impulsivity is not seen just in bipolar disorder. It can be seen in a variety of other conditions too. Uh, Mia and Dr. Mangarian was just talking about. So even in ADHD, you can see impulsivity, right? So it's not like a characteristic feature of mania, but it's one of the symptoms that you see in patients who are manic. We also talk about grandiosity, right? We ask them, do you feel more confident than normal, or do you actually ever had any inflated sense of self, right? That's another symptoms. And then patients with who are in manic episode also have poor insight, right? So patients with bipolar disorder will have very good insight when they are depressed, but when they're manic, they do not have good insight. And that's the reason actually why a family member will be able to tolerate a bipolar disorder patients who are depressed, but the society will not tolerate a bipolar disorder who is manic, right? Because it causes a lot of chaos. So let's talk about what's the neural basis actually for all these symptoms. Now, before we talk about that, so let's talk a little bit about the default mode network. And Dr. Mangarian already talked about default mode network during our depression topic. So the default mode network, the main nodes that is involved is the medial prefrontal cortex. So it's the prefrontal cortex, but the medial aspect, not the lateral, the medial aspect. All right. And then you have got the posterior cingulate cortex, the posterior part of the cingulate cortex, that is the part of the brain that is present just above the corpus callosum, which usually forms a C like this, right? Above the corpus callosum. The anterior one third is the anterior cingulate cortex. Then you've got the middle cingulate cortex, and then you've got the posterior cingulate cortex, right? So the posterior cingulate cortex is a highly metabolic area, all right? And same way, actually, in the medial part of your parietal lobe, there's an area called as precuneus. We also talked about it. So please go back and look at the MRI, and it'll tell you exactly where the precuneus is located, right? So the medial prefrontal cortex, along with the posterior cingulate cortex and the precuneus, forms the default mode network. The other areas of the default mode network is also the medial part of your temporal lobe, right? Now, this is basically a task independent network, right? Or some articles will talk about this as an inward looking network, right? That basically means that these networks are basically looking at yourself, right? Your own thought process, which we call as the self-referential thought process, right? So the default mode network plays a lot of important role, especially when you're not doing anything, there is no task involved, right? So it's responsible for something called as the self-referential thought process. It's responsible for or to access your autobiographical memory, right? Third is it will also usually contextualize your emotions. Okay. Plus, along with the dorsolateral prefrontal cortex, it also plays an important role in cognitive reappraisal. right? And we talked about it. Cognitive reappraisal basically means that it's our ability to detect, right, as well as evaluate an emotionally arousing situation and come up with some coping strategies that you can use to decrease that emotional distress. That's your cognitive reappraisal, right? So it's a function of the dorsolateral prefrontal cortex, but the default mode network plays an important role uh, in the cognitive reappraisal. So if you have a problem with your default mode network, you can have problems with your self-referential thought process. We'll talk about it, what it is. Accessing the autobiographical memory, right? Contextualizing your emotions. That basically means that whenever you process emotions, it has to be compared with the context, right? If you're not able to compare with the context, then your emotions are all over the place. And you see that in patients with PTSD, patients with bipolar disorder, depression, borderline personality disorder, right? You also see it in conditions like alexithymia, where a person is not able to recognize and name an emotion, as well as cognitive reappraisal, right? So all these things will be affected if there's a problem with the default mode network. So let's start with a case example, right? Uh, we see this all the time in psychiatry. So, for example, let's consider a manic patient uh, who impulsively decides to withdraw their entire saving, invest in a business idea that they conceived about 10 minutes ago. And at that particular time, they think that this is an amazing idea. And without any planning, talking to anybody, without the risk assessment or consideration of the consequence for the family, they invest a bunch of money, right? And we see this, right? So we see this impulsive behaviors. They go and buy expensive cars. They spend thousands of dollars on the internet, right? So this is one of the problem when patient is manic. This is how it causes significant functional impairment, not just for the patient, but for the entire family. So let's dive into like what exactly happens, right? So what happens normally, right? And then we'll talk about, so if the normal is violated, then you lead to abnormality, right? So let's talk about what normally happens. So normally what happens is that when you're actually, your mind is wandering, you're sitting and you're just thinking, right? Which we call as internally focused cognition, right? Which is very different than the externally focused cognition, because externally focused cognition is a function of your central executive network, right? This is basically driven by a task or something that requires a lot of attention, right? So when you're internally focused, your default mode network is active, right? Now, what the default mode network actually does is that there are a few processes that happens, right? One is, we call it as self-referential processing, right? That basically, the other way of thinking about it is that when you receive a stimuli, right, when you're thinking, it's basically your personal view, V-I-E, view of the event, right? Let me give you an example. For example, let's take this example where this particular patient actually spent so much money, right? With an idea that occurred to the patient 10 minutes back. So when you are investing or when you plan to invest, so there will be self-referential processing or your personal view of the event, right? So the view of the event is this a good investment, right? You're thinking about it. Or am I doing something really silly and stupid? That's a self-referential processing, right? That usually helps with self-monitoring, right? The second thing that actually happens is there is a social judgment processing, right? Social judgment processing is usually the social dimension, right? The social dimension is, how is this investment going to affect my family, right? Because whenever you're making an investment, you need to actually think about its impact on the family, right? Especially like if you're married or you have parents or you have kids, whatever that is, right? That's a social dimension, right? So this is, I'm talking about investment. The same thing actually we can actually think about, suppose that an attending calls you or sends you an email and says, hey, we need to talk, right? So when that particular scenario happens, what is the self-referential processing or your personal view of the event, right? So what your default mode network actually does at that particular time is that it's going to access your medial temporal lobe, right? And as we said, the medial temporal lobe is a part of your default mode network, right? And the medial temporal lobe has amygdala as well as the hippocampus. And the hippocampus is a part of your default mode network. So what you're doing is you're basically trying to access the memory system, right? As to like when the attending called you the previous time, what exactly happened? Or the attending emailed you the previous time, what exactly happened? Or if you're looking at investment, what happened when you invested in a similar way in the past, right? What was the consequence? Was it good or bad, right? Or did the attending yell at you? Was the attending was very critical? You did some mistakes, right? So all these things actually happens, right? And this in turn actually makes your heart actually race fast, you're sweating, right? So that's basically a visceral response to the thought process, right? And then you have the self-referential processing. It's your personal view of the event. So the things that will go through your mind when an attending sends you an email is that, did I do something wrong? Did I actually make a mistake? Right? Am I such a bad person? Am I even actually good to be a doctor? Right? So all these things actually go through your mind, right? Or you might actually say, hey, the attending called me the last time because I did something really good and the attending wanted to actually give me a feedback about it. Or you might actually say the attending is really nice, actually. Even if I did a mistake, that's okay. The attending is going to sit with me and we are going to actually come up with a plan as to like how to correct this, right? So there's different ways of thinking, your personal view of the event. Then you have social judgment. So when the attending actually calls you, what's the social dimension to it, right? What are my colleagues going to think about it, right? So that is what you actually like. You're coming out of the attending. Is the attending going to talk to other people how bad I am, right? So there's different positive and negative things that goes through your mind. The third thing that happens is the future planning, right? So your default mode network also plays an important role in future planning. For example, in the investment, your future planning will be, if it's a bad investment, how is it going to affect my family moving forward? How is it going to affect me moving forward? If an attending is actually sending an email that they want to have a conversation with you, you will be like, if this is really bad, does it mean to my career? Is it going to put me on a probation in my residency program? Is it going to delay my residency? Or will it actually get me fired from a residency program, right? So these are actually things that you will be thinking, right? So what your default mode network does is that it integrates all these information together, right? And thus the default mode network is responsible for self-monitoring, right? It's responsible also for what we call as a consequence evaluation, right? So it usually keeps you under check, right? So an intact default mode network will help with self-monitoring and consequence evaluation so you keep yourself in check, right? So what happens is that you will not make an investment which was a bad investment in the past, all right? Or you will not make an investment without consulting other people around you, right? So that's a function of a proper functioning default mode network. But what happens in patients with bipolar disorder in a manic episode is there's a problem with the functional connection within the default mode network. So it's not functioning that well, right? So you will have problem with your self-referential processing, the social judgment processing, the future planning. So there's a problem with the self-monitoring and the consequence evaluation. So now you're going to make a decision without actually giving it too much of a thought. All right. So now we know that what happens if the default mode network is not functioning properly or there's a problem in the functional connection. Now, remember, there's a difference actually, right? Functional problem with the functional connection is because of the problem, especially with the neurotransmitter system or due to stress, right? Whenever there is stress, we talked about it actually, there is a disruption in the neurotransmitters, right? This could be actually because of inflammation in the cytokines involved, or it's the HPA axis that is involved. It usually causes a problem with the monoamine transporters and the amount of neurotransmitter that is available, right? That's problem with the functional connection, right? So there is no structural damage, right? That's why actually when you do a plain MRI, you do not see like any white matter changes actually in there, right? Unless like very late stages of bipolar disorder where there can be microstructural damage, right? But usually you do not. Like the MRI will be pretty clean, right? So we are talking about the functional connection problems, not a structural damage to the medial to the default mode network. I want the audience to be very clear about it. Uh, so now, so what happens is that the default mode network, right? There's a problem in the functional connection within the default mode network, right? And then there is an increased actually connection basically seen, that is a functional connection, okay? Between the default mode network as well as the ventral attention network, which in a lot of literature say that it's a part of the salience network. And we talked about the ventral attention network. It involves the inferior frontal gyrus, which is also a part of your ventrolateral prefrontal cortex, the ventral and the lateral part of the prefrontal cortex. That's the inferior frontal gyrus, as well as the temporoparietal junction. So this is your ventral attention network. The function of the ventral attention network is to pick a distractor or a distracting stimuli in the environment, which has some behavioral significance. So whenever there's a distractor, the ventral attention network will be recruited. During that particular time, the dorsal attention network, which involves the frontal eye field and the intraparietal sulcus, right? What happens is that it will re-engage, the ventral attention network will re-engage the dorsal attention network to pay attention to the distractor. So during this particular time, your attention will be disturbed, all right? Any task requires a lot of attention, the performance is going to decrease. So in patients with bipolar mania, you see an increased functional connection between the default mode network and the ventral attention network. What does that mean? That means that the ventral attention network is now going to actually focus on the immediate external stimulus. And the immediate external stimulus is this exciting idea that the patient received about 10 minutes back. All right. And the dorsal and the default mode network also shows an increased functional connection with your salience network, right? Especially like your limbic network. And this is actually going to give an abnormal salience to this particular exciting idea that has not been well thought through. So all these things will lead to impulsivity, grandiosity, poor judgment, and a lack of insight, and the person makes this particular investment, which usually turns out to be pretty disastrous, right? So to summarize, what is happening is the default mode network, there's a problem with the functional connection within the default mode network, right? So the self-monitoring and the consequence evaluation is disrupted. It shows increased functional connection with your ventral attention network. So you basically pay more attention to the distractor, that is this particular exciting idea that we talked about. There's also an increased functional connection seen with your limbic system or the emotion network, which will give abnormal salience to this exciting idea. And this in turn leads to impulsivity, grandiosity that we see in patients with bipolar disorder. I hope this makes sense, and thank you.